but my heart really is in school-based mental health work. And I'll just um, put my 2 cents in. I always loved the collaborative aspect of working with the school. I was fortunate, so very fortunate, to be based at one school full time, Monday through Friday. And that allowed me to build really, really strong relationships, to build trust. And I really honored that I was a guest in the school, and they everyone was just so wonderful. They created a space for me to do the clinical work. I saw students for individual and group counseling, and participated in multidisciplinary team meetings and things. So that was eons ago. I won't say when, but a long time ago. And so now I'm looking at it from a different lens. So yeah, so I really am coming from a place of partnership, collaboration, and wanting to learn more about how community mental health and community providers can help elevate your work and enhance and support you. So I'll be kind of getting into a little bit of that along the way. And Beth, I did, I put some things together today, like the PowerPoint. I've got some, I don't know if they're helpful websites to anyone, but I just kind of wanted to share them out. So I may like post those in the chat in a little while. But if there's things that you were hoping that I would cover, or my email is in the chat. So if you want to have individual conversations or anything, I would love that. This whole year has been super exciting for me to be able to connect with, as you'll see, my programs that I contract manage is just a small microcosm of really what's happening across the state. So I am now getting connected to other folks in other counties that I don't have contracts in. And so that's been super fun. So love to connect with whoever, whenever, however. Okay, so let's get started. So here we go. Yay, the slide worked. Okay, so I'll get into how many and then the funding and everything. But the program design for these, and I'm going to be talking about the Oregon Health Authority, OHA supported community mental health positions to be in pre-COVID times based in the schools, working alongside school staff and seeing students for mental health concerns. So, but the program goal, which I probably should have started with the funding, but the goal overall is to expand the mental health service access for children and youth. Primarily, these programs are strategically targeting areas of rural and frontier regions. And also, I apologize for not spelling out the acronym on the slide. I'll correct that in the future. But for those of you who might not be familiar with an SBHC, it's a school-based health center. And that is also, that's not part of this presentation, but I can definitely connect you or Beth with the person who would be able to talk way more about SBHCs and mental health work within those. They also are partly funded through Oregon Health Authority, but I'm going to just be focusing on the master's level clinicians that are in the schools, so not tied to an SBHC, a school-based health center. So this program that I work with and contract manage for, these are the clinicians that are, again, in the rural frontier areas, but in the areas without a school-based health center. And then the clinicians, so they're embedded in the schools to create immediate crisis response, clinical services, educator support, and consultation. That's just kind of a high level, very basic overview of what they do. In the past, apparently there has been QMHA's bachelor's level staff tied to this work under this funding, but currently it's master's level clinicians providing therapy services. So they could be licensed or QMHP.
Fran, there's a question in the chat. If you could just quickly define rural frontier.
Yeah. Sorry?
Can you quickly define rural frontier?
I will try. There might be someone else on this call that could do it better than me, but I would say rural are the areas where where there is the population density is not very large. You have like just, you know, huge areas of land and region where there maybe isn't even any medical or mental health services. I would say the frontier counties are more of the in-between. And again, somebody could correct me on that, but I'm not really from a state with very rural areas, except Arizona. It was kind of set up like Oregon. But so that's my best definition, I guess. But I can get better definitions for you. I'll work on that. Sorry. So the school-based mental health funding timeline. So just where the funding comes from and how it all came to be. So in 2013, there was significant behavioral health investments made by the legislature, and there was discussions and funding initiated for school-based mental health. There was the need recognized to fund legislatively to fund community mental health programs and have those folks partner, those agencies partner with schools to provide mental health services. So between 2013 and 2014, there was a little over 1 million general fund new investment dollars, and it came from tobacco funds. And they started with 9 counties that are listed here on the slide. So they started kind of small. And again, I've kind of gotten this history from Oregon Health Authority leadership, but it sounded like the funding was kind of staggered how it came to the counties. And it was also the same amounts to each of the counties. So, you know, so it was just, they looked at poverty levels and maybe a couple other things, but like free and reduced lunch programs and things to try to decide which counties, again, looking at like the more rural, not high density counties, you know, areas where there, you know, you would have to go miles before you could even, you know, find a hospital or get linked to mental health services. So that's just kind of the very bare bones basic history for that. And then 2018, there were additional funds that were appropriated to enhance those county services. And then in this last biennium, they really expanded it. And so it's 4.8 million is what we're getting currently. And so we have programs in 17 counties total. So they expanded, they added an additional 8. So, okay. And so, so the funding stream, which I'm still trying to understand it, but the basic gist is that, so it's legislative funds, and I highlighted the health systems division box because that is the area that I live in. That's the division that I live in. Public health is adjacent to us, and they do get funds for mental health positions for staff in their school-based health centers. But again, I'm going to just be focusing on the health systems division, community mental health programming. So the health systems division, so the money comes to OHA, to the health systems division from the legislature. And then from there, we have county contracts, or CFAAs, another acronym. There's so many acronyms. Which stands for County Financial Assistance Agreement. So it's the big county contract, which covers all of the funding for mental health and substance abuse services. And there's just all sorts of line items, you know, and budgets tied to each service. So one of the lines is school-based mental health. And so, so each county gets their pot of money. When it comes to that line for school-based mental health, they can decide whether they want their own community mental health, their county mental health program to provide the services in the schools, or if they want to subcontract out to a local community mental health program. Any questions so far? I kind of get going.
I've got a question, Fran. If is there funding for operation of school-based mental health outside of a school-based health center? In other words, if there's a district where their school board, for whatever reason, is adamantly opposed to a school-based health center, or is that the only funding solution? And then secondly to that, is that for Medicaid eligible only students, or is that for all students who may be uninsured or underinsured?
Thank you for that question. The first question is, no, that is not the only way to get mental health in schools. Actually, what I'm going to be focusing on is the way that's adjacent to the school-based health centers, if that makes sense. So, I know I kind of mentioned school-based health centers. I mention it because this funding, this pot of money, if you will, and these clinicians are strategically placed in areas that don't have school-based health centers in order to expand the mental health access for students. So they are just one individual, one body going into the school. It's not a health center or health clinic. And then to your second question, and I think that might be on one of these next slides, that I haven't looked at this in a little while, but absolutely. These services that these therapists going into the schools are providing are available to any student in the school, regardless of ability to pay, regardless of insurance status. So yeah, I think that's coming up here. Okay, so I already covered this. I'm gonna go ahead and skip on past that. So again, this is adjacent to the school-based health centers. So we're gonna put the school-based health centers over here. So how school-based mental health works, I'm using that acronym, SBMH, so school-based mental health. So typically our clinicians get referrals from the principal, assistant principal, or school counselors. And so they'll do, sometimes it might be a conflict resolution. It might be, putting together a group. It might be, working with individuals. It might be an actual clinical assessment where they are going to be seeing the student for maybe individual brief therapy. Or they might be triaging them to additional services, maybe at the community mental health program. So, but this is just kind of like an outline of how it typically works and the clinical services they typically provide. And then I think I kind of have it probably illustrated a little more in alignment with how you all view, in alignment with like the multi-tiered systems of support. That was really important to me to kind of to highlight how and where these clinicians maybe can live within that multi-tiered systems of support, the triangle. So, and then there's other services on here. A lot of the other things that they're doing, they might be in, walking halls, saying hi to students, again, building trust, building rapport. There's a lot of instances where teachers will ask, for their consultation. Maybe they're struggling with, behavior with a student. And so they can lend some support in that area. I don't have a lot of COVID-centric slides, but what I will say, I'll try to kind of keep that in my mind and throw out some nuggets or facts about like this past year. But the clinicians under these programs have been so very focused on absolutely the students and connecting with them and finding really creative ways in the community and on school websites and things to get the word out that they're available to see students. But they've also been really concerned and wanting to provide educator care and school staff support any way that they can. So there's, small groups or little check-ins or things that they have been able to provide and have provided even to school staff because right now, obviously, everybody needs that. I think I'll stop there again and see if there's any questions.
Fran, there's a question in the chat, and I don't know if it would be better for district discussion time. So Teresa, you're over in, can you say where you're located?
I'm in Union County,
Yeah.
in Grant, at LaGrange High School. So we have that set up in our school, and then there's several other schools in the outlying areas that also have a mental health worker in their schools. But as I noted in the chat, and maybe this isn't the time, but what they've done is when they've hired those, then they aren't hiring school counselors for the other umbrella that we cover. They just feel that we're just hiring for mental health, and then they don't hire school counselors because they say, well, we have a person to help with mental health, which we need for sure. But that's been, at least in Eastern Oregon, that sort of direction that I've seen in many of the rural areas. but they are
Wow.
wonderful and they're very helpful. I would only add one thing that's hard is that because of confidentiality, sometimes we have kids in our building that are suicidal and have really high risk, and we're not even aware of it because they're going there. It's not always by referral. So those have been some things where we didn't even know kids were at risk because of confidentiality. They don't always share with us that information. So that has been a tiny bit of a struggle, but
Yeah, I really appreciate you sharing that. I think, you know, there's when you look at like, you know, school community partnerships and best practices and things out there. And this next slide, I think, kind of speaks to it, is, you know, moving away from just that co-located, and kind of what you're talking about is just the therapist is there seeing students, but they're kind of in a vacuum. And I'm not speaking to any one particular, you know, therapist or school or how it's working, but you know, but we know, you know, across the country, I mean, there's situations like this where they're co-located. So they're there at the school, they're housed there, but maybe they're like in the back of the school in a portable or something, seeing students, and you don't really know what's happening. That isn't best practice. That isn't really the model that, you know, I professionally would want to advocate for, you know, and I think all of us on this call would agree that, you know, the communication, the teaming, the collaboration is super, super important. And also understanding the roles. Like, you know, I heard you initially, what you were talking about, if I heard you correctly, so the districts are finding that they have someone from the community coming in to provide mental health services. So they think that that might be replacing then, or they don't need to provide school counselors. I mean, those are completely two different roles. So, you know, that, yeah, I can completely respect and appreciate your challenges there. So yeah, so this slide, I just kind of wanted to again, bring a visual to this, and I kind of have some examples on the next slide. Specifically, you know, kind of where some of the community mental health program clinicians, where their work lives on the tiers. But, you know, ideally, what I guess, you know, in an ideal world, with, you know, with school community collaborations, what we should be seeing is, you know, that universal tier 1 services would be provided by the school providers, the school counselors, school staff, school social workers. Not that they wouldn't or couldn't provide services at tier 2, tier 3, absolutely. But I think, again, where community providers could, you know, lend some support and, you know, potentially assistance to school staff, is to be able to see those, you know, students who are, you know, presenting in a crisis, or, you know, needing therapy or something. I mean, we all know that, you know, there are, you know, lots of research and data out there that talk about, and I should have posted something in the chat about this, but there's a lot of studies going on right now, and one big one that came out, that most students receive mental health services in schools and in community-based clinics, but actually schools just basically edged out the community-based clinics. So mental health services in schools is huge, and it's where students will, you know, it's a huge touch point. I mean, students, you know, live at school, and I understand, right, I'm putting COVID to the side, but hopefully folks understand what I'm saying. So anyway, I think I've, you know, made the point, but I just kind of wanted to point that out, that I think that, you know, that inverse kind of relationship can hopefully be something positive to strive for. So, and we do, go ahead.
Is it okay if I say something, or do you want me to put it in the
Yeah,
chat?
absolutely. Oh, I know, I'll just keep talking.
We've often talked here in Canby and how wonderful it would be if we were to base DHS and basically community mental health within our own school buildings.
Oh, wow.
Because you know, it'd be nice if we could be under one roof, because we see all the students typically in a normal world, maybe normal school year, and how wonderful it would be if we were to move to the model where we are based within our school buildings, because we've all learned we're more than just places of learning. We're places for, you know, meals and love and care and parenting and mental health services, right? So this is, I'm just off the plan here, but I just want to throw that out there, that's kind of a vision we've had of what you're talking about, is bringing that together, right? Even physically. So anyway.
Absolutely, absolutely. And I offer a monthly meeting to the clinicians and the supervisors of these programs. And, you know, I've been talking quite a bit about the MTSS model, and, and the integrated model of mental health that ODE has recently introduced, and I know OHA has partnered with ODE to help work on it. But I mean, it really is a framework from ODE, and so I've been talking about with our clinicians to, again, they're on the ground, they're doing the work in the schools and in the districts and everything, and they're doing a wonderful job. But I just kind of want them to be centered and rooted in in those school-based systems and in those MTSS model discussions and things, which I think they are. But okay, I borrowed the slide, and apparently there were some little graphics there. So okay, yeah, interconnected framework. That's a great little thing that popped up there. Another framework that's really great. Okay, so school-based mental health. So what do these clinicians do along the tiers? Just some examples I kind of already touched on. But again, the tier 1 mental health, I'm preaching to the choir. So you all know what these tiers mean, but these are just some examples of kind of where their work lives along the tiers. And then this is just if for folks that are interested, this is the snapshot of, which I'll talk about data and numbers here for just a minute. But this is just a snapshot of the last school year. And, kind of, so our, this program, this pot of money, these 17 counties, it's not all of the schools within the county, it's, a select few or a select few districts. So I think we looked at how many, I think it's about maybe 12 or 13% of schools across the state. So, again, it's a small little microcosm of programs. But you can see what's represented here. So it's around 52 clinicians, give or take a couple. And the 1,729 individual students served, that and the hours of the services, I tried to, so let me just kind of pause and stop myself for a second and talk a little bit about data. Before I came on board, there was no one full-time to monitor these programs, to monitor their reporting, what they were doing. Obviously they were already doing great work, but to start to really look at how data from these programs can really inform the work and how we can kind of take things to the next level. So some of this is, I would say, I would kind of look at it, tentatively, because some of the data was definitely missing when I started from reports and things. But that's probably a big piece that I am working on right now, is bringing all of these programs have to report quarterly. And so bringing these programs to more fidelity, having them get more accurate with their reporting, having them identify and use screening and outcome measurement tools so that they can actually be reporting to us what the impact of their services is having. So that's something that's going to be coming up in the next contract year, that I'm hoping to kind of elevate their program, their reporting that they're doing to us, doing with us, so that they can be hopefully highlighting work that they're doing, but in a more data informed way. So again, this is just kind of a snapshot, and you'll see to the person's point before related to like Medicaid and private insurance, the little bubbles there. Most of the students that are seen do have Medicaid. There's a significant percentage that there aren't any services billed. And again, that could be at the request of the schools. This funding, I should have said also, this funding covers positions. So it's not, covering services or anything, it's actually covering salaries. And it's not fully covering salaries plus benefits. Let's just say that. But so that is a way, if they do bill Medicaid and private insurance, it's a way for them to recoup some of those dollars, but it's not something that actually the programs are very protective over and would probably err on the side of not billing or even bringing that into the school. So hope that makes sense. Okay. So I think Let me see. I think I'm going to stop sharing for just a minute. And I do have a couple things that I want to put in the chat, but I kind of have been rambling and I don't know if folks have questions.
Yeah, Fran, we have a
Or
couple things in the chat. So
yeah.
Michael was really interested in how do you get the word out about this to districts around the state? It sounds like there's 15 people on this call, and just wondering, how do we spread the word? And then he was just mentioning that they had other money that was spent, but if this is an opportunity for districts to apply for a grant, or however that, or if that's the county that applies for the grant, how does that happen to coordinate services for students?
Yeah, so right now, I'm not aware of additional. I mean, I know that we have for this biennium contracts have been, county contracts have been renewed, and so we have the same amount of money that we had last year. There is, of course, the American Rescue Plan. And so the way that it's been described by OHA, Oregon Health Authority leadership, to us is that it's going to be an avalanche of money coming to us. And so we've been, sending lots of our ideas and things to our leadership about how we can spend federal dollars. I would hope that some would come our way so that we can expand and have more community mental health programs, partnering with schools across the state. Right now, this is the 17 counties that we're contracting with. To my knowledge, they're not, this is the amount of the general fund dollars is capped, I guess, if you will. So I'm not aware of additional funding from the legislature coming our way. I would say if, I've been contacted by some other counties that we don't have these programs in. And I would just, I've been wanting to connect with folks at least just to kind of build that connection. Because everything that I keep hearing from my leadership is that, you never know, there could just be like this big pot of money that could fall from the sky and they're going to want to know, what can you do with it? Where can we put it? So I that's probably not the best answer. But yeah, I don't think there's, like an opportunity to like expand, the 4.8 million that we have right now. Actually, the other piece I'll add is this money that's distributed to all of these programs. What we're doing right now is trying to establish a metric to make it a little more fair and equitable, because everyone's been getting the same amount. And these are regions and areas with different levels of need. And so we're now trying to co-create that with the counties, with the schools, the districts. We've been surveying those programs that we're involved with to learn, what metrics they use to determine where to put their dollars. But I would say, if you're interested in, collaborating with your community mental health agency, and, if there's a way to have, them work in the schools and provide the services, then I would absolutely think there would be a way that we could maybe help facilitate those conversations. And there are ways, really, like around Medicaid billing for private insurance, that, there is a way, even without outside of this OHA funds, to do that. I would think so.
So Fran, would a
Long answer,
district,
sorry.
so a question in the chat was, does a district reach out to their county mental health? Like, how does that get set up with a district to get the services?
Yeah, I absolutely would start there. And, I'm happy to, listen in, help facilitate any of those conversations. I don't have, direct communication with all of the community mental health programs across the state, but in the counties that, we have the services in, I do. But yeah, I would absolutely reach out and start there. I would also be mindful of the fact that there is, and if anyone's interested in looking at it, OHSU puts out an annual report every year. I probably can take a moment and post it in the chat or email it to Beth and she can send it out. But it is it's an annual rural unmet health needs report. It's not the most positive report, but it definitely highlights, it highlights oral health, mental health, medical services, and basically the shortages, and the FTE, like in the regions. So you can see, like in one county, how many actual mental health staff are in the county, and that kind of gives you an idea of how far families have to travel for those services. Of course, some of you probably already know that, but yeah. So
Thank you.
what other questions? Yeah, I'm really sorry. I'm kind of going through the chat, and I really did not define the rural and frontier very well, but I can kind of put something together and send to Beth.
If you all have questions and you want to speak up, please feel free to unmute yourself and ask.
I'll just ask my last one because I'm super confused. So, but I'm also in Multnomah County, and we have a huge, strong partnership with,
Yes.
and we have mental health. So part of me is missing, like, is this funding that's just available for rural or frontier districts versus if we're in partnership, we pay for our services as well as not everybody in Multnomah County is paying for their mental health services. So I'm just a little confused. So I need some more information to help if I need to have a conversation or if we're good to go.
Yeah. So I just, Beth asked me to come to the meeting today to introduce myself and just kind of talk about the programs that I am the contract manager for at OHA, and what they do and where they are. So it's kind of more of like an overview. So.
Fran, I think
I'm friends with the, oh, sorry, go ahead.
Fran, I think some of the tension you're hearing is that those of us in administrative roles, we've just put our budgets in, and to the tune of millions of dollars, where we're actually paying for these services. And so I think where the rub is that if we're actually entitled to a share of these services, that's where I think you're kind of hearing some of the questions and confusion, in particular around being really crisp about what is a rural, what is a frontier, do we fall within that? And if we do, I'd like to go back before all of us are on the same budget cycle. I would like to go back to the drawing board on my budget and say, so I think that's kind of maybe some of the tension that you're feeling with the questions. So anyway.
Yeah, I don't know that I'm really feeling tension, but I think that I'm probably not doing the best job at answering the questions very well. And I apologize. I was just hoping to come and share information about the programs, but I can definitely, take this back and kind of simmer on it and see if I can get some answers for you. And Beth, I think I'll probably need to follow up with you and have a little conversation too, to make sure that I can, provide the best information possible. So
I think there's
happy
just
to do that.
Yeah, I think everybody's just kind of wanting to understand how that they can, have this a person work with them, and how does it work? So do they need to go to their county to be written into the plan that's submitted for the grant funds? Is it, so I think it's just part of the process behind the scenes of how to make that work.
Yeah, so that is a good question, and I'll take that back to Chelsea, my behavioral health director. Again, these funds are kind of built into the county contracts. So, I think probably a good place to start would be the county mental health programs, your local mental health authority, to see if there would be a way to have these services in your schools. But again, I wasn't really anticipating these questions, and so probably erroneously on my part. So I can definitely circle back and get some answers for you.
Thank you.
I can add, as a rural area, and I'm friends with the person at our mental health agency. She's one of the directors there. And I'm pretty sure it started out because we sort of partnered also where we had a school-based health center nurse in our building that we shared some money, and the Medicare reporting that you do when you fill out those surveys generated to help pay. So it was kind of a partnership. And I know from the conversations I've been in is that part of, because in all of our areas, like some of our towns don't even have a grocery store. I mean, it's just a town with kids in their high school has 100 kids. So they don't have access to any mental health. And so it's been really positive for rural areas. It's not like they can even go in here. They might have to drive an hour to get to a therapist or to attend. So I do believe, at least from my understanding, is that it was a grant that was written by the mental health agency and they partnered with the schools, and it was sort of like we paid some and they paid some. I know, and I don't know the details of the money piece of it, but I do know that that's how it started, and the school has to agree, and I think they pay a portion, and and the mental health agency also in our counties pay a portion as well. But it's been a great service, and I hope there's enough money for everybody. But like I said, some of our kids, even finding therapists, is like they have to drive an hour or further to get to someone.
Mhm.
Is there other questions for Fran about what she's presented on? Fran, I'm wondering if this might be a good time to just kind of learn from this group of anybody that is working with someone that's the school-based mental health.
Yeah, I'd love to hear.
Yeah. Does anybody currently, any of your districts work with someone that is, and how are they providing services? So a couple questions. How are they providing services with your district? It might look different across districts, so I'm just throwing it out there. And then how is the coordination happening with comprehensive school counseling programs and others that might also be mental health trained? You know, is there defining of roles, responsibilities, kind of who's doing what, maybe by tiers or within their scopes? So just want to hear from all of you.
I'm happy to throw it.
Oh, you go. No, Denise, you go. And then I'm just so happy because Michelle Kim's with me and we can talk a little bit about what we do in Hillsborough.
Awesome. So Centennial School District is in East County. We're considered a medium-sized district, so less than 6,000 students. We have partnerships with 4 mental health providers. So we have a partnership with the county, we have a partnership with Trillium Family Services, we have a partnership with Northwest Family Services, and we have a partnership with Western Psych. And still not enough. We could use more resources, but specifically since we're talking with the county, we have county mental health providers in all of our buildings. We have 10 schools, so at 9 of our buildings. One of the individuals is based out of our school-based health center at the high school, and then the rest share time between our other schools. And so our mental health providers from the county are definitely a tier 3 support for students. Our school counselors are the ones who vet referrals and or identify students as a part of our multi-tiered systems of support. And then based on the student need and or depending on space, they determine, you know, is this one that makes sense for a Trillium referral? Does it make sense for a county referral? Our Trillium referrals typically are for students that have more acute needs, potentially might need med management, might have more holistic family services needed, and potentially might need long-term care and services. Whereas counties, since each year at the end of the year, they stop seeing students and you have to restart the next year, it's more for students who have some short-term needs. Our folks collaborate with our counselors all the time, and it seems like they all have it figured out how to support that tier 3 need, and they can consult with staff as needed.
Thank you, Denise. Brooke, did you want to go?
Yes, Denise, I'm wondering, how do you assess or track out of the partnerships that you're working on, who the systems are best serving and supporting, and are you doing like a gap analysis? And what does that look like?
Brooke, I wish we were that fancy, so we are not keeping track in that regard. Buildings more are keeping track of which students have they identified who need services, which students and families are willing or able to engage. And then when we're not able to engage them with one of the specific organizations, then our school counselors end up being the point person in providing supports. But I appreciate that question, and I got to step up my game and figure that part out with our providers and our staff. But we get
Well,
monthly.
I'm not that fancy either. I just want you to know that. But I wanted to get there. So that's why I was like, oh, maybe you were onto that, and I'd love to know about that. But I can share what we're doing in Hillsborough. I did put in the chat just the timing of this. Is important to know that your districts are writing, if you are the district person or if you're in a building, they're writing their high school success plans right now, AKA Measure 98. And one of the resources that are in our middle and high schools, and Michelle Kim's going to talk a little bit about what that looks like in partnership in a high school, is something called our student support and wellness counselors. So that we wrote that in our Measure 98 plan, and that's how we fund those positions, which is more in a focus and a partnership in a more of a social work lens, and how they work in partnership also with our care coordinators and also our community partners. So that's just something I just wanted to toss out there, because the timing of that may work out too when you're thinking about funding, and that's what I heard some of you also asking about as well. What we do in Hillsborough is, at our middle and highs, we have that position I just described, and then we also pay, and they are part of one of the county providers. So through Washington County allocating those funds, Youth Contact, and our Youth Contact providers are in our high schools. And then we also have our comprehensive school counselors, and then our student support and wellness counselors. So in partnership through care coordinating meetings, kid talk meetings, that system of support is kind of that wraparound on how who's going to support in which area. Michelle, though, can you talk a little bit about like what that looks like in a building? Because I'm kind of talking in a 50,000 foot district lingo right now.
Yeah, so kind of how we kick it off in the building is, as far as supporting students, is whenever a student comes up as a concern, whether it's through our kid talk or care or just our teachers, we automatically put them on our our care team, and look at what the needs are. We contact families if it's appropriate. But I also have to say our care coordinators have a big partnership with our local agencies for counseling. And so they're able to get our students in a little quicker if we refer them through our care coordinators versus us sending the parent and the student directly to make a phone call or get an intake. So we honestly rely a little heavily on our care coordinators in that sense. But for students who don't want like outside therapy or outside counseling, it will fall either on the school counselor, or it'll fall on the wellness counselor here, or our youth contact. Our youth contact will meet with students twice, just one-on-one, but otherwise there's strictly family therapy. So if the family wants to engage, we have that for our students and families. If the student just wants to meet once a week, 30 minutes to an hour, and is okay, our student wellness counselor will have a caseload of students. But it all starts with the school counselor, just to make sure that we close the loop as far as supporting the student, not just with counseling, but holistically through academics and anything else that they might be involved in with the school. So the school counselor will always know, and that's kind of how we keep track too, is we work with, I don't know about you guys, but we always have 1,000 spreadsheets, right, with tracking systems. So just trying to track who's meeting with who, because obviously we don't want to double up, but we also don't want to have the student talking 3 times of the same conversation. We want to make progress. So we really rely heavily on each other to collaborate and work with them. But as soon as something comes up, it's right on care team, it's right to kid talk. And then from there, we decide which direction we need to go as far as supporting our kids.
Great. Thank you, Brooke. Michelle. Oh, I'm sorry. I was just going to say, if people have questions, is there someone they should reach out to, either of you or someone in your district, to just learn more, if anybody on the call wants to go deeper?
Well, I think next month, we're going to talk a little bit about, we run an every other month community partnership meeting, and that really helps as well, because we're in a partnership with Western Psych. We serve 10 of our schools that way. We have a partnership with LifeWorks Northwest and with Youth Contact. So we have that, and those are 3 of about 25 different community partners that come together. And that communication loop helps a lot. What I am still missing, and this is my hope for next year, is sitting side by side with buildings to really identify how the systems of support are working in that direct partnership. I can speak in a district level, but I'm not like what's working really well and what is not working really well, and how do we refine those practices? And then once again, who is the system serving and not serving for students and family support? So we do a good job, I think, of just connecting and dialoguing and discussing, but really drilling down to each building and ensuring that the structures and supports are working is what I really want to get better at, especially going into next year as we have more and more students entering our buildings.
Thank
And
you,
Fran,
both.
I'll just
Sorry.
add to what Brooke is saying a little bit as an outsider, that Hillsborough has been leading for, I'm going to argue, the last 20 years around like care team coordination. And I would argue that Hillsborough is probably one of the best in the state for doing this. I remember 15 years ago as a practitioner, like going out and doing field trips to what the work y'all are doing. So it's exemplary work. I would say just to kind of counter that in a smaller district, I'm in Molalla, we're in South Clackamas County. Our data was showing that out of 33 referrals to mental health a month, this was 4 years ago. So 33 referrals per month with about 20 to 22 school days. Families that would go to the initial intake was 2. And then those that would keep going with services was 1. And so I kind of followed Denise's lead at Centennial, and obviously it was built before Denise started there, but you still get credit, Denise. We partner with Trillium Family Services, really for Medicaid only school-based mental health services. The politics are really important to understand. In rural settings, in my rural setting, the school board actually, we put it to the school board to vote on the agreement, and there was actually no dollars exchanged because it was all billing for just Medicaid students only. We actually had 2 board members that voted against the services because of fears around the liberal agenda and transgendered youth and things like that. Now, this is 3 years later, we have 3 full-time therapists. We're buying about 32 hours a week this year of prevention services, which in Trillium's model is like providing some services to kids that aren't on OHP. I don't think our board will ever get to a place where they can get behind a school-based health center, but certainly they now see the value in school-based mental health. So I think that's just another example. I'm seeing, Fran, you're chiming in about family engagement. Absolutely. So the dynamic that's also at play is that idea of local control, that schools operate independently and they're in very different places. And my hat's off to my colleagues on this call that have been leading this work for a long time. That I'm learning a lot from seeing y'all work. So thank you.
Thank you, Michael. I'd like to give the other Michael time to talk to you, please.
Sure. So I'm with North Clackamas School District, and I think many of us or all of us have been working on addressing students' needs for years. And so when COVID hit, we were in an okay place, hopefully, but needed more help. So in North Clackamas, we have 2 3,000 square foot school-based health centers that have mental health providers, primary care, and oral health dental operatory in them. We're building 2 more. So when we finish, by the end of the summer, we'll have 4 school-based health centers that offer those services, 1 in each high school that serve all the kids in the feeder system. And then we've been fortunate too, it's taken years to get to this point, but we've worked with Trillium for about 13 years and Western Psych for about 7 years. And right now we have 100% of our schools that have at least 1 full-time mental health therapist embedded in the school. And we haven't paid any money for those services until this last year. At the middle schools, at the high schools, we have about 3 mental health providers, and then we also in the middle and middle schools have a half-time SUD provider, and high schools have a full-time SUD provider for substance use disorder, and that's paid for by Measure 98. So this year we added some funds for just mental health, just to help with the underinsured or non-insured families and to help them bridge that gap. So it's more gap funds, and we contracted with Western Psych for that. I'm going to try to share my screen and see if this works. Beth asked if I would share. Can you see that? Okay, Beth asked if I would share. This is a flyer that I created this year. When the pandemic hit and we moved to a virtual world, it was a goal of mine to be able to connect families directly to our resource partners. In the past, I've used our counselors as kind of the screen also. And I do believe it's really important to keep the counselors connected to families and to know what mental health services are being provided, or honestly, other services that are providing in our school district. But we created this flyer because I wanted families to know to be able to, as quickly as they could, go from, they have a need and to be able to find the answer for that from our partners. And so this has worked really well. We have it in different languages also. And so I wanted to have a version like this that could be in teachers' hands, that they could send out in counselors' hands, and just get out and saturate our population in our school communities. So this has worked really well. We have Western here and who they take, which insurance companies they take. A lot of this with mental health starts with, what is your insurance? That's something we didn't know 15 years ago. School principals never asked the question, who do you have for insurance? And now, our school principals, our counselors are pretty savvy about, that's really the first question that you have to ask. So I don't know if you can see this only as I scroll or if you can see the whole thing, but I went ahead and scrolled up some. And
Michael, people are loving your PDF. Is it okay if I share it in the chat?
Yeah, you bet.
Thank you. I'll do that if you want to keep talking.
Nope, and that's we only have a minute left anyway, so I will quit sharing as soon
Michael,
as
I want to say I work for Gresham Barlow School District, and we have multiple North Clackamas parents that work in Gresham Barlow. And this was sent to me by multiple staff members saying, hey, can we replicate this for Gresham families? And I certainly tried, and also realized that we don't have as many resources as, kind of trying to follow that guideline. It was kind of hard to try to replicate. We don't have Wichita Center. We don't have, the services split up really nicely like that. So it's a really great visual. And I've tried to replicate it for our district with what fits in ours.
Yeah,
So,
thanks.
thank you.
Before, I started, it took me about a month to get to the place working with all the partners, arranging if this would work, or if I could reestablish, and adjust how parents communicate, contact with them, and work with counselors to adjust their understanding of their role in referral. And took me a good month, probably the month of July. And then I started working on this flyer. And so it was, I don't know, I wanted this to look as simple as possible. But of course, like most things, there was a ton of work to get to that point to make it look like it's very simple.
And I think that's what's visually appealing about it, that it's like really easy to follow and really easy to figure out like what your needs are, how do I access? So kudos to you guys for leading that.
Yeah, good. Thank you. Thank you, Beth.
Yeah, thank you for sharing that. Is there any other questions for Michael or anybody else on the call that has questions? I see people are jumping off or have to go, and I know we're at our end of our time. Does it feel like an hour is enough? I mean, I know that like there's so much to cover, so do you feel like we need more time, like an extra half hour added on? I could send it out to the group and see if we should tack on an extra hour or half hour to our meetings, but there's some good information and sharing. Brooke, are you waving goodbye? Okay, thank you. Thanks for sharing.
Yeah, Brooke just said in the chat,